It's 1:15. We're talking to Dr. Bob Titzer, who's started a program in the early 90s, called Your Baby Can Read. It is being used here in Australia. And we have a parent online, Bob, who is using the method. Lynn Cotty, good afternoon.
Good afternoon. How are you?
I'm okay. How's it going for you?
It's going really well, actually. Better than I could have ever dreamed, I think.
And is it easy to use?
Well, it is. Look, here's the thing. I'm a linguist, and I was also taught to read as a baby. So I'm really into that method. What I used to use was the Glendoman method, which is flashcards, and it's the parent interacting with the child. And that was all fine. That's what I thought I'd use from the very beginning. I've got 3 little girls. My eldest girl, who's 6, has also got a disability called Credit-Shah syndrome. So she has global developmental delay, basically, and still is learning to talk. But when the other 2 came along, those flashcards became really hard to do. So I did some more research to see what I could do to keep up her educational program, and found Your Baby Can Read. So I put that on for her, and for the other 2, and the results have been amazing. I'm just blown away.
How long have you been doing it, Anna?
Let me see.
Lynn, sorry.
It's been about, goodness me, Chloe must have been 3, so I guess it's been about 3 years that we've been using those on and off. I've not only have I seen all the things that Bob was talking about, the very young children being able to read and that sort of thing, but as a linguist, again, I'm a linguist and language therapist, so I help children to read. And I've seen just about every sort of reading disorder that you can see. What I've seen... You would have also seen how it can hold up development. What can hold up development?
If children are having problems comprehending and not being able to read.
Absolutely, yes. Look, that leads into poor social skills, inability to listen, all that sort of thing. And I'm very, very glad that my children aren't going to go through that. Even my 6-year-old, who's at a specialist school at the moment, but apart from all those great results, there were other things that they could do that I didn't expect, and I do attribute that to the Your Baby Can Read DVDs. For instance, Chloe, my 6-year-old, went to a language specialist, a communication specialist last year, and we found out she could spell. Now, I'd never taught her to spell.
Right. We have a lot of children. Did you say your name was Lynn?
Lynn, yep. Lynn, yes.
Okay. We have many, many, many children who are spelling at age 4, 5, and 6. We even have some children as young as 18 months of age who just love spelling.
I find that amazing, and really, honestly, you should put that on your promotional material as well, because it's
you're right, because we don't even have that mentioned.
Lynn, thank you very much for spending a few minutes with us. Anna is online. Hi, Anna.
Hi, how are you?
Good.
Look, yes, I read the Glendoman books 30-odd years ago. My son was autistic, and I discovered at 3 that he could read, but he couldn't talk, and I got him to talk through flashcards. And then when my daughter came along at 2 1/2, she could read, and one day her flashcards went to the daycare centre, and they had her sitting there all day performing for the parents because they couldn't believe that she could read all these words. And it's really helped them. And my son, even with a disability, he can read and write and spell, and at 4 he walked into a paediatrician's office, and he had a poster on the wall, and my son looked at it and said, "The International Year of the Child." He read it at 4.
It's great. It gives great heart, I'm sure, to many parents and grandparents who are listening at the moment. Bob, it's been wonderful to talk to you. Anna, thank you for your call. It's really giving kids a head start, isn't it? That's the whole idea.
Yes, it is, and there's only one natural window for learning language, and it passes by very quickly. I'm really glad to hear that all these children who have learning disabilities had early stimulation, because if they would not have had that, their lives would be completely different. And sometimes we don't know how things are going to turn out, so if you give the child early stimulation, that's always in their best interest.
And both of those callers also emphasizing that they've spent time and done it with the kids.
Yes, and that's always in the best case scenario, but there are parents who are extremely busy, and this is very helpful because even if you're on the phone for 5 minutes, your baby has tens of thousands of new brain connections forming every second. So if you're on the phone paying no attention to your baby, it's much better to just put the baby in front of the Your Baby Can Read video and the baby can learn language skills. They do comprehend the words also. I want to mention that.
Thank you very much for joining us. If anyone wants to go online, yourbabycanread.com.au. Dr. Bob Titzer, thank you.
Thank you.